Good evening and welcome to Talking to Thursday. And if you are not out enjoying that sunshine, you must have got fed up with it, or you've decided that there's something amazingly important on the TV. Oh, you're maybe about to watch Eurovision. I do not know. But anyway, if you happen to have ended up here, thank you for joining me. And I've just moved to the other side of my office because I've got a really good view and the sun's beating down, and I'm standing in here thinking, what am I doing in here this evening? Listen, I am here every Thursday about this time and I talk about teeth, and it can be any random subject relating to oral health. But this evening I thought let's talk about plaque, not the one you stick on the wall, the one that gathers on your teeth and is responsible for, or it has a key role in the development of both tooth decay and gum disease, which are the most common non-communicable diseases of mankind. They cost the global economy a fortune, and that's before you start to consider pain, loss of hours at work, school, the requirement for antibiotics in some cases. So as I say, there's a lot more to plaque than maybe you think, you're right. So we're going to have a bit of a, I don't know how deep a delve it is, but possibly a deeper delve than you've maybe had before, and to sort of help a little bit with some of the newer terminology. Now, as the sun comes and goes, because I'm working from a window rather than my light, you may find I jump into shade, which do not worry. It means I'm probably just not about to totally keel over with the heat, because it's actually really warm in here this evening. So let me share my screen, because that is what I would like to do. And we will see how we go. Let me see, what am I going to share? Is it sharing my screen? That's what I want to share. And I am hoping that this will work. Because sometimes, those of you who've been here before know that me and technology are not always the best of friends. And sometimes I have issues. And quite often I'm going around going, has anybody got a 10-year-old that can help me? Anyway, here we are. This is what we're talking about. Dental plaque, the common denominator. It is the thing that probably most dental professionals will tell you is the biggest challenge to get patients to engage with and take ownership of, because it is a very personal thing. Our plaque biofilm is different. And actually, to sort of get on board with this is something that you can do for yourself. And I think that's the thing. We still have a thing about, long as we go to the dentist, as long as we go to the hygienist, all will be well. And yet, you know something, 95 or more % of maintaining good oral health is in your own hands. It's the time and effort that you put in. Now, there's no doubt that some people have more challenges with that for maybe dexterity reasons, or, you know, not being able to afford an dental brush. There's a whole lot of reasons, and there's a whole lot of other much wider determinants of health, which I have talked about in the past. But dental plaque biofilm, whatever you want to call it, a sticky skunk that gathers on our teeth and our gums, is something that we control and we can do something about. And it doesn't need to cost a lot. It requires time and some effort. But the key is actually doing it regularly enough and effectively enough to keep your mouth healthy. And that will be and can be slightly different for all of us. So you will know somebody who never seems to clean their teeth, never has a problem. You will know somebody who spends very large amounts of time on their oral hygiene. They do everything the dental profession have advised them. They see the dental profession really regularly, and they still have problems. And that difference comes down to how each individual's body responds to the plaque biofilm, the bacterial plaque biofilm. So, you know, basically it's a sticky biofilm of microorganisms that develops on surfaces in the mouth. Now, that's not just your teeth. It's anything else hard that you put in your mouth. So it will be dentures, it will be retainers, it will be crown and bridge work, it will be fillings. So it gathers up in anything. And usually you sort of, if it gets thick enough, you'll see it's sort of a yellowy, whitish sort of jelly-like substance that gathers around, particularly around the gums of your teeth. So if you take a fingernail, if you haven't brushed your teeth all day, take a fingernail and scrape down from the neck of your teeth. And what you'll probably feel is a little bit sort of jelly-like stuff on your fingers. That's plaque developing. Starts to develop as soon as you've cleaned your teeth, and it matures over a period of time. So what we're going to do is, as I say, have a little wander through what we really are talking about, and less of how to remove it, because I've had loads of stuff to do with that. But we're definitely going to look at what it is and what you need to understand about it, because it has got a really important role. So I say, big sticky pile of microorganisms that gathers on your tooth in sort of like a gel-like matrix that develops in the surface of your teeth. And if you think of a biofilm per se, not necessarily a dental biofilm, but a biofilm, if you think of a vase, vase, or a vase, anyone that's ever bought flowers, left the flowers in there for a while, and you've got like a greeny scum that's developed, that is a pardon me, that is a biofilm. And you will also know how difficult that is to remove. If you see a pathway that has been particularly underwater for a while, it gets slippy, that is a biofilm. So it's sticky, it's tenacious, and it's that matrix that holds the bacteria that are in your mouth on the tooth surfaces against the gum margin, and has a major role in developing tooth decay and gum disease. Also has a big role, is a key role in peri-implantitis, so the failure of dental implants, has a role in oral malodor, so bad breath, denture stomatitis, so it'll stick on there, and if you're not removing your dentures at night, if you're not cleaning your dentures, and that's lying against the soft tissues, you can get like an oral flush stomatitis developing underneath that. So think of it as a little community, a community of bacteria that is stuck in a sticky matrix, which comes from saliva and the bacteria themselves. And it's, as I say, it's stuck together with this sort of self-produced glue-like substance. And that's what makes it so difficult to break down. This is the reason why things like mouth rinses don't remove them. Some can neutralize them. It's the mechanical friction that actually breaks down and removes the plaque biofilm, a dental plaque biofilm in your mouth. And that's the hard bit, because if your toothbrush bristles, your endodontal brushes are not making contact with the plaque biofilm, it ain't going to go anywhere. And it's that movement, that breaking down of that sticky stuff. So I'm trying to think, if you've used a Pritt stick, for instance, and it hasn't gone everywhere, and you sort of get bubbles, so you get bits of it lifting off. So you can break bits of it off, and then it'll have to reform. The biofilm can have to then start to stick together again. So you do get some of the plaque biofilm breaking off. But by and large, it is one of those things that it needs mechanical removal. Think the difference between splashing your face with water or actually taking a face cloth and actually making contact, and actually the friction of removing dirt on your face. I'm trying to think, is there any other way? No doubt I will come up with more analogies, because those of you who know me know how much I love an analogy. So moving on from that, it is basically quite a diverse community of microbes, some of which are good for us, what we call commensal, so they're meant to be there, they're good for us, and some of them which are quite harmful and can produce disease. So they can drive the disease process. Our biofilm comes really from our oral microbiome. The dental plaque biofilm comes from the oral microbiome, which is in our mouth. So lots of people are aware of the gut microbiome. Well, the second largest microbiome in your body, because they can be separate in the one body, is your oral microbiome. It has got a very diverse collection of microbes in your mouth. and it has evolved over time. And thankfully, our knowledge has also evolved over time. And, we know far more now about its role in health and disease. We do not know everything. That is absolutely sure. We definitely do not know everything, but we know an awful lot more. And as we have learned more, there's been changes and modifications to the terminology which dental professionals use to talk about plaque, biofilm, microbiome. I mean, microbiome is a fairly recent one of that. And you will hear more talk about specifically about the oral microbiome and how it's discussed in relation to oral health. So first of all, I'm going to talk a little bit about microbiome because, as I say, people tend to be sort of familiar with that concept of your gut microbiome and having a healthy gut microbiome, not so much about having a healthy oral microbiome. And yet it is really, really important for our oral health. And because there's connections between our oral health and our overall health and well-being, it has an impact on our overall health. So basically, we're a body of bugs, for want of a better way, a body of microbes, let's be more accurate about it. And what are microbes? They're little, tiny little living things that we find everywhere, all around us. Microbes, microorganisms, they're far too small to be seen by the naked eye. So in other words, as my use of microscopes and things like that have developed, we've learned more about them. They live in water, live in soil, live in the air. So if you think about our mouths being warm and wet, it's a nice environment for bugs, basically. And what you may not realize is our bodies are home to millions and millions of these little microbes. And some of them can make us ill. Others are really important for keeping us healthy. And for millions and millions of years, the microbes that live in our body have evolved and coexisted with us. And for the most part, that's in a sort of balanced relation, symbiotic, a balanced relationship. And, we can't actually cut ourselves off from our microbiome. It is part of us, and what has now been described as a sort of basically we form with our microbiome, we form a super organism or a whole belt with the microbiome, and that microbiome plays a significant role in our physiology and in our health. And it's interesting to know we're not colonized at random by these microbes. Our microbial residents have evolved alongside us for millions of years. And as our environment has continuously changed and developed through history, our microbiome has also evolved with us. So, we went through periods of, if you think about Industrial Revolution, modern eras, things like the use of fire, inventions of agriculture, increased access to processed foods, including refined sugar, and, antimicrobial therapy, all are very likely to have influenced the composition of the human microbiome. And a huge study of microbiome ongoing, and I think it's fascinating because we're going to keep learning more and more. Microbiome, was that a term I learned when I was a student? Absolutely not. When did I first hear? Certainly, probably the first time I became aware of a gut microbiome was probably, well, I don't even know how many years ago, but I knew about a gut microbiome before I heard the first terms about oral microbiome, and very much that was driven by my periodontal, my gum specialist colleagues, and going to national, international conferences and hearing their research development. So what do you need to know? It's not just us and them. It's not the microbes and us. It's both of us. Our microbes are part of us, and that relationship between the microbiome and us, i.e. the host, is quite dynamic, and it's influenced by many things in a modern lifestyle. So, you'll have heard these things before because I have mentioned them before. Diet, tobacco use, stress, all of those can alter our microbiome and the properties of the microbiome. And then that can offset our finely tuned sort of ecosystem, which is our bodies, and it can tip us out of balance. creating what we call a dysbiosis. So again, if you've been here before with me, you've heard me talk about balance. And I talk about the things that keep you healthy versus the things that make you ill, and how much you have to try and maintain that balance to create that sort of nice symbiotic relationship to keep us healthy, and our bodies healthy as well. Different compositions of microbiomes in different parts of our body, believe it or not. So your gut microbiome will not be the same as your oral microbiome. There may well be some of connection, because whatever goes on in there goes elsewhere in your body. And we always say, what goes on in there and what is put in there affects so many other parts of your body, so much of your systemic health. But the microbiomes are different in different parts of our body, and it's also different for different people. So, you're going to find things are different. You can't just say there's one size fits all. And I often say this about when I'm working with clients and we're coaching, and we're saying, you're not going to be the same as your partners, your children. We are all unique specimens. We are all individuals, and our microbiome will be individual to us. Okay, so there's a good word for you, a holobiont. It is that super thing that we are, that makes up our microbiome and our bodies, basically. So we're this super organism that has, as I say, has got lots and lots of bugs going on back, well, microbes that go on inside it. So I say your mouse has the second most diverse microbial community in your body. Okay, so it's got about 700 plus species. So there's a lot going on there. 700 plus 7,800 bacteria colonize all the hard surfaces of your teeth, the soft surfaces, the oral mucosa, so in other words, your cheeks, your tongue, the whole lot. And it's quite a busy wee place when you think about it. It's a horrible thing to think there's stuff going on in your mouth, but it is. And as I say, we tend to be very clued in about the gut microbiome and how that balance being out of kilter, and how that can make your tummy upset or give you other GI problems. But we don't necessarily always think about that balance in our mouths and how that can be disrupted, and it can make us poorly. So there are lots and lots of benefits for a healthy microbiome and having that symbiosis for our overall health and well-being. It's really positive, lots of positive effects. So just transfer that into your mouth and think, actually, there's lots and lots of benefits of having a healthy microbiome in your mouth. And I think we're only going to ever learn more about this in the coming years, and I think it's going to become more talked about. It's going to become more mainstream, and it's something that you may want to find out a little bit more about. And there's loads of really good research going on, scientific evidence that is well worth looking up. If you're not sure, give me a shout and I will point you in the right direction of lots of reading. Bottom line is, we cannot ignore our microbiome. As if we are this super organism, this holobiont, we need to respect the microbes that actually live in us and on us, because microbiome in your skin as well. So let's not go there, because we're going to go down another rabbit hole, and I go down enough rabbit holes as is. So no disrespect to rabbits. But the microbial part of this human holobiont is at least equal to the number of our own cells. So that gives you an idea. As I say, that's why I'm saying, we're pretty much a body of bugs, if you want to look at it that way, quite brutally. But it is a community of microbes that are in our body. And I say some are good for us, others aren't so much. And they all share our body, and they all need to get on quite happily. But it is only very much in recent years that we actually have learnt of the importance of this relationship between the good bugs and the bad bugs, and their impact on health and disease, not only of our overall health and well-being, but also of our oral health and well-being. And even if you think of mouth rinses have gone through, and this has sort of been very generic, how mouth rinses have gone through sort of phases of popularity. And at one stage we went through, don't use the mouth rinse at all, because it's going to wipe out all the good bugs and the good bacteria in your mouth. And that's one of the reasons why you sort of want to look at a mouth rinse as an adjunct. It's an extra layer for doing the mechanical stuff. You cannot avoid the mechanical stuff. It's the hardest bit to do, and yet it's the one that's going to get you the biggest bang for your buck. The other bits are added on to that sort of, and yes, there's no doubt some mouthwashes definitely have benefits, but it's the sort of thing that you're best advised individually. So anyway, microbiome has definitely evolved as we have, because we're not the same as we were hundreds of years ago, never mind thousands of years ago. And the introduction of refined sugar has definitely had a big role in not only in our diets, but has a big role in how our microbiome has developed, because some of the bacteria have responded to the refined sugar that has been introduced in their diets. I'm not talking recently, I'm talking, post-industrial evolution time. Even things like toothbrushing, that has had an impact on our own microbiome. So we've got to consider both. You can't just, as I say, look, just, there's them and there's us. It's the host and our residents, if you want to think of it like that, which are the microbes, and the whole lot is this holobiont as a whole package, so to speak. And the disturbances and alterations of the oral microbiome through our modern day lifestyles, doing unto ourselves, can have big consequences for our general and our oral health. And it is something that I sometimes discuss with clients, that, we didn't have this problem 50 years or 100 years ago. Our lifestyles are not the same as they were 50 years or 100 years ago. And if you were here last week when I was talking about the changes since VE Day, and the reading that I did around that, to just reflect on how much has even changed since the end of World War II, it's quite staggering. Ultra-processed foods, what was that? I don't remember ultra-processed foods as being a term when I was younger, as a student. But just think about how our lifestyles have changed, how, even think post-pandemic, if you want to look at it like that, even think about how we live now compared to how we lived pre-pandemic, how we don't walk as far as we used to, we don't use public transport, or we get in our cars, hardly walk 200 or 300 yards. So as I say, our lifestyles have changed, and that has changed the microbiome. And it's not just about having the bad bugs in our mouth, but it's how the good bugs actually deal with the bad bugs. So think of a community, pardon me. So think of a community, and think of community life, that you've got some good folk and you've got some not so good folk, and you've got rules and things that sort of keep the bad ones under control. And your mouth isn't a lot different to that. So you've some good bugs, you've got some bad bugs, and you've got them living in harmony, because the good ones basically control the bad ones. But when the bad ones get the upper hand, that is when we can have problems. And they can get the upper hand for a number of different reasons. But basically, in dysbiosis, that fine balance of your sort of mouth ecosystem is disrupted, and that allows those disease promoting bacteria to get the upper hand and cause conditions that are right for developing disease. So things like tooth decay, caries, dental caries, cavities, things like gingivitis, so bleeding gums, and even further on to periodontitis and peri-implantitis, because again, our dental plaque biofilm is key. Early warning sign is bleeding around an implant, and that's a big thing to prevent an dental implant failure. So having this balanced microbiome is really important to both obtain and maintain or restore oral health. We want to avoid dysbiosis, because that's where the things have gone out of kilter, we're out of balance, and that's where we can end up with problems. So what you want is that sort of nice, normal microbiome population, the good ones and the bad ones, that are all living quite comfortably together, and they're not having anything major to upset them. So Think of the oral microbiome as a community, sort of like a big umbrella. So it's all the microorganisms, the bacteria, the fungi, the archaea, the viruses that live in the mouth, live in the oral cavity. They're all floating around there, doing their thing, quite cool, quite happy with it all. The oral microbiome is a very broad term which includes all the microorganisms. Dental plaque then refers to a very specific type of microbe community that develops on the tooth surfaces. And the biofilm is sort of the term that's the glue that allows the bugs of the microbiome to stick on the tooth surface, which is dental plaque. You will see these terms mixed and matched. And yes, you'll get definitions for each. But, you know, if you think of the biofilm, as I said, think of it like the green stuff inside of a vase or vase, you know, it's sticky. The gunge off leaves and stems stick to it. So the dental biofilm is the glue that the bacteria that are happily floating around in your oral microbiome start to stick and loiter on the tooth surfaces. The biofilm holds those bacteria where you probably don't want it to be for any length of time. And yes, you can argue semantics, you know, and there is a certain amount of that, and you will find, you know, you find half a dozen different dental professionals will give you variations on that theme. But, you know, I think that's probably the simplest way of thinking it. You know, plaque is primarily composed of bacteria and other microorganisms that stick to the tooth surface in the plaque biofilm. You find it on the tooth surfaces, you find it between teeth, you find it on the biting surfaces, you find it along the gum line, because along the gum line you've got a little cuff. I'm going to show you that a little bit more clearly in a minute or two. But that dental plaque biofilm is developed from that sort of broader oral microbiome, which has a role in oral and systemic health. Dental plaque is associated specifically with tooth decay, gum disease, and ain't easy to remove. So it is formed over a period of time. So the dental plaque is this community that evolves over time, like any community. You know, it's funny, I was talking last week about new towns and how they were sprung up post-war to get people out of the cities, out of that urban environment. So if you think it's sort of like your microbiome, your microbial community, and it's formed, and you get a dental plaque biofilm forming around the tooth surfaces, and it develops throughout life, and it's different, believe it or not, if you have a vaginal delivery at birth when you're giving birth, or cesarean section, believe it or not. So it is affected from the way you're born, never mind when you're born. But even by 3 years old, it's a pretty complex microbiome going on in our mouths and our bodies for that matter. But though the bacteria then, I love this quorum sensing thing. I always, when I'm talking to students, dental professionals, I always say, go and look up quorum sensing. But bacteria within a biofilm communicate. But weird, maybe, but they communicate with each other. And they do this term of what's called process called quorum sensing. And there is a lovely lady, and you will find her on YouTube, Bonnie. I've forgotten her last name, it's gone out of my head. Just even Google Bonnie quorum sensing, and you will get a really easy to understand explanation of how bacteria communicate. And that's how that sort of colonization of the bacteria in the biofilm forms, and how it actually then creates a defense against other competitor bacteria, and also how it adapts to changes in the environment, the oral environment. So I say it's interesting stuff if you want to go down that rabbit hole. I love that sort of stuff. So and I probably don't explain it terribly well because not my area of expertise. I know what to do with it once it's formed, and I'm really good at that. But actually, all this is really interesting, really exciting pieces of research, and there's other people far smarter than me that have basically come up with the research that has actually supported what we advise you and how we help you. So how does it actually develop? Our microbiome is there. It's always there. And the biofilm lives locally on our teeth and other hard surfaces. So as I said, it might be your dentures, it might be a filling, it might be a crown, it might be your retainers, it can be a whole lot of things, okay? Any hard surface, you're going to get biofilm starting to stick on it. And I tend to think sort of you get what they call the acquired pellicle, salivary pellicle forming within minutes. So you take a totally clean surface, this pellicle starts to form, and it's a soft, sticky layer of bacteria. And it's comes from the bacteria themselves, the food debris in your mouth, saliva, proteins. So that's sort of one of the reasons why it's called salivary pellicle, been called acquired, been called a number of things over the years. And that forms within minutes of a totally clean tooth surface being presented to your mouth and the microbiome. Then, within hours of tooth cleaning, it starts to mature. And it starts to mature, within hours. 24, 72 hours, if you are not brushing it or removing it, it becomes quite a stable little community. So it's got its friends around, they're getting a bit older, they want to get up to more mischief, and they're all hanging out in this biofilm thing. What trouble can we cause in this mouth? And then if you just ignore it, or it lies there undisturbed, nobody bothering it, nobody giving it a nudge, nobody sort of shifting it and telling it to move on, with your toothbrush bristles, of course, you get minerals deposited from the saliva. So, this can start anywhere from, 72 hours after plaque formation, and actually in some cases before that. So over time, over between sort of a day and a couple of weeks, depending on the conditions, depending on your mouth, depending on your teeth, depending on your calcium phosphate ions in your mouth, that can become calcified. So this plaque biofilm becomes hard, and it becomes that hard, rock hard, like stone mass on your teeth. And if you've sort of ever taken a mirror and looked in behind your lower front teeth, you'll know what I'm talking about. That sort of like yellowy white stuff. And you can't scrape it off with your toothbrush. It's not coming away. It has calcified. And it's like somebody taking a bucket of wet cement on a perfectly clean wall and taking handfuls of the wet cement and flinging it on the wall, and then just leaving it there and letting it dry, and it will dry rock solid. And then what you can do is you run your hand over it, and it feels really, really rough. That is the tartar calcifying on your tooth surfaces. Now, once it's calcified, it's inert, but because it is a rough surface, biofilm will love a rough surface to stick on. So more biofilm sticks on it. You ignore that develops, matures, calcified, and so we can have more. And I sometimes say to people, you can have clean tartar, you can have clean calculus, because you're not letting the soft plaque biofilm that's developing on the surface get a grip, get to the calcification point. And it's one of the most frustrating things for people I talk to, is the fact that, they keep getting tartar built up in behind their lower front teeth. And the most common places for calcification of plaque biofilm in your mouth are behind your lower front teeth and the outside of your upper molars. Why? Because that's where your salivary ducts empty into your mouth. And what does the calcifying? The calcium and the phosphate ions in your saliva. So if you've ever noticed somebody has a big yawn and you see like a spout of saliva coming out from the floor of the mouth, that's their salivary ducts, and it's sitting like two hoses just going, yeah, and it's going to calcify that. And as I say, if you've got a high level of calcium phosphate ions in your saliva, that can calcify really quite quickly. And again, that's why some people get more than others. The key is always breaking down that plaque biofilm before it gets to the point that can actually calcify. So knowing where it is really important. So where does it actually develop? Let's have a look at this. Now, it develops in teeth, it develops on gums, and see in the rounds that you can see the crevice of the gum margins here. It's sort of like that rolled sort of edge. And I sometimes think it's a bit like looking around your cuticles, around your fingernails, or just underneath your fingernails there. If you've got short nails, you still find stuff sticks underneath there. Basically, plaque biofilm will develop and mature anywhere that it can attach to the tooth surface or a hard surface in your mouth. and lie there undisturbed. Okay, so it can then colonize and mature and cause you problems. So let's have a look. There's certain things that help plaque development, help plaque biofilm stick around your teeth. So basically, there are nooks and crannies in your mouth where the activity of your bacterial biofilm can sort of mature and evolve over time without you having any say in it, basically, because you haven't given a nudge, you haven't given it a brush, you haven't actually broken it off. And there's some things that actually are more likely to hold plaque around your teeth. So we call them plaque retentive factors. Plaque retention does what it says in the tin, it retains plaque around your teeth. So if you've got crooked teeth, for instance, and this is from the BSP, British Society of Periodontology's guide for young practitioners, you can see how crooked teeth, how that area is that bit more difficult to clean. And the other thing is, look at the staining on that one tooth. So if you take a toothbrush across there, it's hitting that surface, it's hitting this surface. What it's not doing is getting in there. And that's where actually taking your toothbrush instead of the long, narrow way, swinging it around it's the long way, you're going to get in that, or a single tufted brush. So if you've got crooked teeth, that is a plaque retentive area and it's going to be harder to clean. And it's one of the reasons why I'm always saying, watch what you're doing when you're cleaning your teeth. Look at where you're trying to clean. So, that's the area in behind those lower front teeth. And you can see a bit of staining there, but you can also see that yellowy, that's tartar, that's where that's calcified. And can you see where the red bit of the gum is around there? Just shows that hint of inflammation developing there. So the chance that might bleed a little bit. Healthy gums don't bleed. If you haven't brushed your teeth or cleaned in between for 2 or 3 weeks, yeah, you expect some bleeding initially. But over 2 weeks, 3 weeks, that should stop completely. And if it doesn't, you want to go and speak to a professional about it. So you can see how difficult this is. So this is the SDSEP guidelines on periodontal disease. So crooked teeth, lone standing teeth. So you've got one tooth standing and nothing either biting on top of it. So if there's nothing in contact with it, that biting surface is prime location, is prime real estate for bacterial plaque biofilm, because there's nothing to disturb it, there's nothing to break it down. So when you bite and you chew, there's a certain amount of friction there. But actually, if that tooth's just standing there, it's not hasn't got a mate opposing it, it's going to be a problem. Likewise, if you're not getting right the way around all the sides of a lone standing tooth, that will be a problem. Rough surfaces on anything, it could be a filling, it could be a poorly contoured crown margin, it could be anything basically, tartar, all that encourage biofilm to develop on the tooth surface, and the bacteria did love to get in a bit of biofilm, get caught up, get snuggled up, bring their mates around, start to cause you trouble. Things like poor saliva flow. So if your mouth is dry, bacteria can multiply more rapidly in a dry environment, because your saliva flow helps to buffer and neutralize acids, got all sorts of nice goodies in there to help keep your mouth healthy. It also helps your self-cleansing mechanism, so your ability to actually sweep your tongue around your mouth and clear food, little particles of food. So often I talk to people who have got a really dry mouth and are finding that food's actually really hard to clear. That's why often you'll have a glass of water while you're eating, just to help keep things moving in your mouth. The other thing that affects it is not cleaning your teeth and poor oral hygiene. And I know some people have problems, real difficulties with maintaining good oral hygiene. And that's what we're for. That's what I spend my days doing, is helping people that help themselves. But given the right environment in the mouth, plaque is going to play a role in a disease process. If you put lots of sugar in there, come on the cavities, bring on the holes in your teeth. That's how dental caries develops. If you have the right bacteria to trigger gum disease, and your body So the host response isn't managing that level of inflammation, because what happens is bacteria trigger inflammation in the gums start to swell up and bleed like any sort of inflamed area. And if your body's host response, immune response is not managing that, that can then progress into a much more serious gum disease. So healthy gums don't bleed, really worth remembering, because if your gums are bleeding, you're wanting to be asking yourself, why are my gums bleeding? Why are they bleeding now? And what can I do to get that to stop? Okay, because by and large, gingivitis, which is the early sign of gum inflammation, is reversible, and it's reversible fairly quickly. It just requires a bit of time and effort on your part, your teeth, your mouth. You've got to put the effort in. So as I say, bleeding gums are your early warning sign. So the key is disrupting and removing the plaque biofilm regularly enough and effectively enough without doing any harm to either the hard or soft tissue. So you don't want to damage the teeth, you don't want to damage the gums, but you've got to do it effectively enough and regularly enough to keep your mouth healthy. And what we know from the scientific evidence is that you brush your teeth at least twice a day, you will get about 60 to 70% of the tooth surfaces reached with a toothbrush, okay, whether it be manual or electric. I'm going to come back to that in a minute or two. The other 30 to 40% of the tooth surfaces, you ain't going to get with your toothbrush. So you've got to use something else. And there are plenty of things out there. If you have never cleaned in between your teeth, now's maybe a good day to start. And I have 5 and 6-year-olds flossing. They're not doing it brilliantly, but they see it as part of their basic oral hygiene routine. I think that's really important for parents. Once 2 teeth are in contact with each other, in theory, they are at risk of not being reached by a toothbrush. And that's why it's really important to introduce the concept of interdental cleaning early, because it then becomes part of your routine. I think we wait far too late in life to mention cleaning in between teeth. It's got to be one of those things that forms a habit early. It's a healthy habit to form. So just to go back to the cavity thing, you've got all the things that are going to increase your plaque bacteria around your teeth. Then you're going to throw in a bit of sugar just for good measure. Now that might be in the form of you put sugar in your tea or your coffee. It might be a fizzy drink. It might be a wee plain biscuit, which has sugar in it. It might be the things that you think of, obviously, buns, cakes, biscuits, sweets, all that stuff. Yeah, all got sugar in it. The more often it's there, the frequency is important. The longer it stays there, so in other words, sometimes the texture is important too. So it's the difference between sucking a toffee or chewing a curly whirly. Do they still exist? Or having a piece of plain chocolate, which clears from your mouth quite quickly. The longer it's there, over a period of time, you are going to get the tooth surface demineralizing. Basically, the tooth surface starts to melt because the sugar and the bacteria produce acid, and the acid start to burn a hole in your teeth. So cavities will form. And it is one of those things, you have to have the sugar. You can have lots of plaque, but if you don't have sugar, you're not going to get a cavity develop. And again, I've got lots of conversations. My kids never get sugar. I never eat sugar. And sometimes it is a matter of peeling back the layers and looking where did the sugar come? It came from somewhere. It might be yogurts that that taste sweet, but they are sweet. In one case, it was extreme use of tomato ketchup. So, there's a reason, there's always a why. And one of the ways that I've always worked and I continue to work with our clients is with an alter ego that sits up on my shoulder and goes, why? Why are we saying this now? Why is this like now? Because if you can work out the why, then you have a hope of doing something about it. Whether you choose to or not, totally up to the individual. But I will be there to help support developing healthier habits and help motivate you actually to have a healthier mouth for life, because most people I know don't like spending time in the dental chair. Not necessarily a fun day out. So what you want to try and do is, look at when you're eating sugars and how you're eating sugars. So sugary things, meal times only, avoid them the hour before bedtime. Think that hour before you go to sleep as the golden hour. Water, plain milk, and I mean plain milk. I don't mean soya milk that is sweetened. I mean plain ordinary bog standard cow's milk. Milk and water, only safe drinks for kids, certainly, and for the rest of us, by and large. To drink black coffee, tea with milk, fine. It's when you start to put the sugar in it that you're into a different ballpark. Longer you leave plaque lying around your mouth, the more mature it becomes, the more the bacteria have evolved and developed, and the more problems they can give you. Is your mouth dry? Because have you got the ability, your saliva flows there to buffer and help neutralize the acids and remineralize the tooth surface, because that's the calcium phosphates that also harden the plaque into tartar, also help to remineralize the tooth surface. So when you put sugar in, calcium phosphate ions leach out, basically. Think about a sponge. And then when you finish eating or drinking your sugar attack, what happens is your saliva comes along like the cavalry and fires all the calcium phosphates back into the tooth surface to harden it and remineralize it and actually get it back to health. The catch is that when you put sugar in your mouth, the demineralization starts almost immediately. Saliva, like all the best things in life, take time. So it can take anywhere between 20 minutes and 2 hours for that remineralization, for your mouth to become back into that healthy, neutral pH point. So as I say, you've got to have time. That's one of the reasons I have sort of simplified the message down. If you eat at meal times only, you know, you've got much less chance of having to worry about, oh, what's in this? Is there sugar in this? If you've got enough time between one eating or drinking episode and the next one, the chances are, as long as you've got reasonably good saliva flow and you haven't got a whole lot of crooked teeth, and you don't have too many challenges as far as your form of your teeth goes, you should be fine. So if you have got 3 sugar attacks per day, including meal time, 3 to 4 sugar attacks per day, including meal times, you shouldn't have a problem. Between 4 and 6 sugar attacks a day, including meal time, depends on other factors. You may get away with it, you may not. If you have more than 6 sugar attacks, including meal times, every day, over time, you are going to end up with cavities. And as they not a fun day out to get them fixed, and even more so now because trying to get somebody to fix them. Let's not go there, because that's a whole story and it's other for another day. Probably I've gone over it before anyway. So what about your gums? So we've still got those same plaque retentive factors there. So we've still, anything that holds plaque around your teeth, stops it getting cleared away, is going to be a problem. If you've got half a dozen dental implants and you find it hard to get the plaque off, then you need to do something about it. You need to find a way of cleaning it. And I do have some issues about designs sometimes, which make it nigh on impossible for some people to actually clean around dental implants, and dental implant retained dentures can be really, really fiddly and difficult. Now, where there's a will, there's a way, and it just takes a bit more time and a bit more practice, but it can be done. So you've got these factors, so you've got the things in your mouth. We've other things that actually we know are risk factors for gum inflammation and gum disease. So things like tobacco. Tobacco use is, we know smoking is bad for us on a whole lot of levels. It's a common risk factor for a whole lot of things. But gum disease is one of them, serious gum disease in particular. Diabetes, particularly poorly controlled diabetes. Stress, I mean, who talks about stress? Does your dental team ever ask you about stress? Are you stressed? Are you anxious? How do you manage that stress? Because how that changes how our bodies respond, how our bodies react to the plaque biofilm in our mouth. So the bacteria, then how our bodies say, oh, not very sure about this. So stress is a big thing. Medication, lots of medication, hundreds of medications that you can actually buy over the counter have a side effect of a dry mouth. When your mouth is dry, the bacteria multiply more rapidly and cause problems quicker. Okay, hormonal changes. Now, I often explain, inflammation, gum inflammation, from the perspective of somebody a pregnant woman. So you get to say 25, I don't know what the average age of pregnancy is these days, but you get to say 25, 30, and you've been doing the same toothbrushing routine since you were 10, 15, and you become pregnant, and all of a sudden your gums bleed. You haven't changed anything to do with your oral hygiene routine. What's changed is how your body is responding to that bacterial plaque biofilm. And that is the difference. So that is your tipping point for the dysbiosis. And it happens at puberty, also happens at menopause. So hormones are one of those things. Socioeconomic status, now that's a ballpark all in itself, but we know people who are in lower socioeconomic groups have a higher risk of not just gum disease, but a whole lot of diseases, and that's related to housing, diet, and I say you can go on long and hard with that. But you also have things like alcohol abuse, and these are things that are starting to raise their heads with gum disease and other oral diseases, obesity, bucket loads of common risk factors. And again, how your body responds to the bacterial plaque again can change. Lack of physical activity, who knew? Yes, it's good for us in a whole heap of levels, as well as being good for your gob. So keep that in mind. Poor nutrition. And again, we've had this thing about toothbrushing programs, all these toothbrushing programs, which I applaud, is a really good idea. But nobody's talking about sugar. You cannot talk only about one aspect of things that affect our health, our overall health and our oral health. We need to have a very joined up approach. We all need to be singing from the same hymn sheet, whether you are a dental professional, you are a teacher, you are an online influencer. If you have got the right messages, you can actually share that, because we need to all be talking the same thing, because we need to look at the systemic risk factors as well as the things that we can modify, like smoking, like, toothbrushing. There's some things that you can't change. So if you've got a family history of gum disease, that's going to increase your risk. Getting older affects your saliva flow. Can't really do that. So there's some things that you can't change. But the things that you can modify and change, we should certainly consider. So I say, one of the most important risk factors for periodontitis, serious gum disease, is cigarette smoking. And it is something that we can look at actually trying to help with. But even working with some of our healthcare colleagues, and actually making sure that they know and understand how they can actually impact and affect their patients' overall health and well-being, as well as their oral health. Lots and lots of common risk factors that we should all be taking opportunities with. And as I could go on at length, just because I'm a bit like that. But it is plaque biofilm affects way more than just your mouth. We know poor oral health is related to poor overall health and well-being. It's Mental Health Awareness Week. So please look after your headspace this week and every week, because I think we're getting better at talking about mental health than we were pre-pandemic. But the number of young people who are suffering from anxiety, and they're becoming so much more conscious about their appearance, of their falling in line with their peers, and their mouths can be affected by that. So their ability to have a lovely smile, it all ties in together. Was also Gum Health Day on Monday. So we're talking about Gums Rock. That was the theme for, Gums Rock, nipping, that's a really bad pun, getting early signs of gum inflammation under control really can help you in the long term and save you an awful lot of grief. Because once you have got gum disease, once you've got periodontitis, you have periodontitis for life. It's not something that you just have treated, put in a box, and never have to think about again. You are a periodontal patient for life. What you then have to do is control that level of inflammation to make sure it does not raise its ugly head and cause you more problems. So basically you control it and you maintain it, and that is very much a team effort between you and your dental professionals. So I say there's lots of common risk factors for oral systemic disease and health and well-being. And when you actually look at these figures of the prevalence, the incidence of the most common dental diseases, tooth decay and gum disease, they are so much more than all 5 of the most common non-communicable diseases. That is scary. And yet we tend to think of oral health separate to our overall health and well-being. And then when you start to break it down and look at mouth cancers, talk about looking at tooth wear, you start to think, well, actually, hold on here, what else can I do for myself? Because prevention is by far the better part of the cure. It could save, looking at oral health in the context of overall health and well-being could save millions. There's no doubt about that. As I say, just think of time taken out of work, sleepless nights due to pain, time off school, treatment costs. Dentistry is not cheap. And neglecting your oral health is way more expensive than the treatment. So, because it's the treatment that then actually has to repair the damage. And once it's repaired, you have to maintain that repair. It's not, again, something that it's, you have one crown, it's going to be for life. Somewhere along the way, the surface may change, something may happen to it. So let's break this down a little by numbers. Excuse me, one second, I get my... So plaque control by numbers, and again, I could go on about this all night, but I'm not going to. Thank goodness to some of you, I'm sure. But brush at least twice a day. Okay, last thing at night, one other time every day. Other time generally tends to be in the morning, but if you are only going to be brushing once a day, make it last thing at night before you go to sleep, because when you go to sleep, your mouth dries up. And if you have not got clean teeth when you go to sleep, bacteria multiply more rapidly in that dry environment. Again, think of mouth breathing, think of snoring, again, we could go down that rabbit hole, I'm not going to. And don't forget, if you have got dentures, if you have got implants, if you have got retainers, they all need to be cleaned as well. They're hard surfaces, they're in the right environment in your mouth, and the plaque biofilm will develop on them. So, it's not enough just to rinse it underneath the tap. You need to do this mechanical cleaning. Bristles on the surface, like your teeth surfaces, you've got to break up that plaque biofilm. Clean your teeth, clean between your teeth at least once a day. Generally speaking, before you brush, but just make it fit in with your day, fit in with your lifestyle. If you're sitting in the car park waiting for the kids to come out of school, do it then. Keep them in your pocket. If you've got a couple of minutes at lunchtime at work, do it then. If you have a shower when you go to the gym, put a couple in your bag, do it then. It doesn't really matter as long as it's done some point in the day. That'll get that sort of 30 to 40% of the tooth surfaces that your toothbrush can't reach. Whatever you use for toothbrushing, whether it be a manual toothbrush or a powered toothbrush, maximize the potential, because the technique is different. You do not use an electric toothbrush the same way as you use your manual toothbrush. And it is probably one of my greatest disappointments is when I see YouTube videos of dental professionals using an electric toothbrush inappropriately. I think that's the most diplomatic way of putting it. So they're using it the same way as they use a manual toothbrush, and when you not even read the box, cracks me up every single time. But as I go off on one on that. So electric toothbrush, you just park it around where the gum of the tooth meet, let the power do the work for you. It's really boring, but it does do it more effectively, because a power toothbrush, whether the bristles go like that or right, whatever way they go, they move far faster than you can make the bristles in your tooth surface. So you just park it, let it do the work. Outside of the tooth, inside of the tooth, biting surface. Every surface, all teeth along the gum line. Okay, just take your time, watch what you're doing. And that's hard because you can't really see what you're doing. You can't actually see this stuff. It's sort of like a whitey, yellowy stuff, but is it there? Is that just the edge of my tooth? Is that a stain? It's really hard to see. And that's where disclosing the plaque comes in. Disclosing solutions are around, disclosing tablets are around, just disclosing toothpastes around. Some interesting things available these days. But if you've got a bit of red food dye, that'll do the same thing. Put it in the end of cotton bud. Put Vaseline on your lips first, please. Put even cold cream, something on your lips first. But your lips will also go pink, blue, whatever color your stain is going to be, because it stains the protein part of the plaque biofilm. So put that on your lips first, then a little cotton wool bud around your teeth, or if you've got a disclosing tablet, chew it up, spit out, have a small rinse of water, give a good spit out, then have a look. So you will see it having stuck to the tooth surface. You'll see where you're trying to direct your bristles, where you're trying to direct that mechanical movement. Really, really useful. And don't forget about your dental team, because that's where you're going to get that one-to-one in-depth advice about controlling your plaque. And it's one of the reasons why it's so important that you're really open and honest about on your medical history, your social and family history. Because the more information your dental team have, the better the advice and the guidance that they can give you, and make it easier for you to help yourself every day. Because as they see you 2, 3, maybe 4 times a year. Probably definitely not any more than that, or very unlikely it's any more of that, compared to 365, or if it's leap year, 366 days a year. Whose effort has the biggest impact? What you do every single day has the biggest impact. You want to use a fluoride toothpaste, lots of Stannous fluoride toothpaste around now, and Stannous is quite good because it has really good antibacterial properties as well. Always, by and large, spit your toothpaste out, but don't rinse out afterwards with water. You may have been advised to use a mouth rinse, and they may advise you to use it specifically after you brush your teeth. That is very much a one-to-one. You can't make a very wide, sort of broad aim over that. And to be honest, you know, that is an extra layer. Your mouthwash, using a mouthwash is an extra layer of mouth care. Do the basics regularly, do it well. And I say, go to the dental team as regularly as they recommend. Might be that they advise you to see the hygienist twice a year, or 3 times a year, even 4 times a year, even more in some cases. And see the dentist may only be once a year, may only be once 18 months, which for those of you who've been brought up in an era that you went to the dentist every 6 months, that might turn your head slightly. But if your dentist does not want to see you for 18 months, believe me, you're getting a pat on the back, you're doing well. You just need to keep it up, and you need to make sure that you are keeping up your end of the bargain. And if for some reason your circumstances change, that you're not able to look after your mouth the way you normally do, that's when you want to let them know, do they want to see me before that 18 months is up? And even if you've got no teeth at all, you still want to be seen by a dental professional for no other reason, if for no other reason, to have your mouth cancer screening done. And that is so, so important. You do not follow Growing Smiles, please do, because the one thing we are quite religious about every single month is reminding you to check your mouth for signs and symptoms of mouth cancer, because it could actually save your life. So, controlling that plaque biofilm. Hopefully you're a bit more informed than you were earlier on about plaque biofilm. I hope so. Hi, Tony. Sorry, I didn't even realize you were there. I had my mouse over your face. Sorry, Tony. But, you know, look after your mouth. It may benefit you far more than you actually think. Eat well. Try and have for 3 eating episodes a day, including, you know, that your sugar and acid. Avoid that hour before bedtime. Clean well, in between once a day, toothbrushing at least twice a day, and then be well. Be well 365 days a year. That is, look after your health, look after your overall health and well-being, from your mental health to your physical health to your oral health. Your dental team are there to support you, as are we. I will stick some links down below. If you have got questions, let me know. I will be loitering with intent. Oh, gracious me, I was on a roll tonight. Can't believe I was so long-winded. Apologies. If you've stuck it out this far, thank you very much. But if you've got any questions, I will be here for about another half hour. So until next week, look after yourself, look after each other. I will be here same time, same place next week, but look after yourself, look after each other, and don't forget to brush your teeth before you go to bed tonight. Thanks for joining me. Take care. Night.